Hi there. Welcome to FPL, and welcome to your new hire benefits presentation. My name is Erin, and I represent Northwestern Benefit. I'm looking forward to spending this time with you. We'll kick off our session discussing what new hire enrollment actually is, as well as some housekeeping items, followed by a quick introduction to my team at Northwestern and how we can be a resource to you. Next, we'll highlight all the benefits offered to you this upcoming year and walk through each line of coverage in more detail. Finally, since this is a pre-recorded video, we won't have the opportunity for live questions, but you're always more than welcome to reach out to either HR or us at Northwestern if you'd like to review anything in more detail. One side note, throughout the presentation, you'll hear me reference benefit summaries I've attached. You'll find clickable PDFs in the lower left corner of the screen each time I introduce them.
New hire enrollment refers to the first opportunity you have as an employee to enroll in FPL's benefit plans. Your benefits are effective after 90 days of full-time service. Once you've made your benefit selections, you'll be locked into those plans for the full plan year. We encourage you to take the time you need to review the benefits with your family and come up with the best plan selections for your situation. Now, there's just one exception that allows you to make a benefit change in the middle of the year, and that's if you encounter a qualifying life event. Examples include getting married, getting divorced, having a baby, having a dependent child that reaches age 26, or if your spouse has a change in employment status. If you encounter a qualifying life event, you have 30 days to notify HR and make any corresponding changes. Otherwise, the selections you make will be in effect through June 30th of 2019, since FPL's plan year runs from July 1st to June 30th. At the annual open enrollment period, which takes place around June of each year, you'll have a window of time to make any changes to your plans, which includes dropping or enrolling in coverages or adding and dropping any dependents on your plans. Before we dive into the benefits, I wanted to educate you on a few pertinent items relating to recent healthcare reform updates. You may remember back in 2014, the individual mandate was introduced. This mandate states that all individuals are required to have medical insurance or be subject to a penalty in the form of taxes at the end of the year. That being said, if you enroll in FPL's medical plan, or if you're covered on your spouse's group medical plan, or even if you've secured a private medical plan on your own, you've met the requirements to avoid a penalty. But please be aware that if you choose to waive coverage at this enrollment during 2018 and don't have coverage elsewhere, you'll be facing the tax consequences at the end of the year. While the latest tax bill repealed the individual mandate, that doesn't take effect until 2019. So if your first date of eligibility begins in 2019, this individual mandate penalty does not apply to you. Now, along with introducing the individual mandate, the exchange was also introduced, and this serves as another method for an individual to purchase a medical plan. These plans are all offered on a federal or state level and also satisfy the penalty requirements. Now for the good news. As a part of the Affordable Care Act, you're now allowed to cover your dependent children on your medical plan up to age 26. It doesn't matter if they're in school, out of school, or married. There are no longer any stipulations. In addition, pre-existing conditions no longer can prevent you from being insured. Regardless of any ongoing medical issues or ailments, you're allowed to enroll and receive the same benefits as the rest of your colleagues. And lastly, and we'll talk about this in a little more detail in just a few minutes, but when you're seeing an in-network provider, your preventive services are covered at 100%. That means zero cost to you.
As I mentioned, I'm Erin Gordon, and I'm your account manager at Northwestern Benefit, the insurance broker for FPL Foods. You'll see me from time to time around the office, but you'll want to become more familiar with these two lovely ladies. Meet Jackie Burns and Nicole Travis. They are your dedicated benefit service specialists assigned to your group, and they'll be more than happy to assist you with any benefit-related issues you may have. Looking for an in-network provider or hospital? Have a question about how much your upcoming surgery may cost? Or maybe you need some assistance getting a claim pushed through. No worries, Jackie and Nicole are here to help. You'll find their email and phone numbers in your benefit brochure, so please keep that information handy throughout the year.
All right, it's time to talk benefits. I've listed a summary of all the benefits offered to you for the 2018-2019 benefit plan year. You'll see you're offered medical, dental, and vision benefits with Blue Cross Blue Shield. We'll then take a look at the life, disability, and complementary employee assistance program, all offered by OneAmerica. After that, we'll take a look at some voluntary benefits offered through the Colonial. And lastly, we'll briefly take a look at the 401k retirement plan offered by ADP Retirement Services.
First out of the gate, I'd like to introduce your Blue Cross Blue Shield medical plan. Before we get started, please note that for the purposes of this presentation, we'll be looking at in-network benefits only. The plan has both in-network and out-of-network benefits, but you'll save yourself and your company money by staying within the network. Should you wish to review the out-of-network benefits, please refer to your benefit brochure or plan summaries. Now back to the regularly scheduled program. The medical plan is your standard copay plan. So for your routine medical expenses like doctor visits, urgent care visits, ER visits, and prescriptions, you have a set copay and will know exactly how much you'll be required to pay. These copays kick in on day one of the plan, and you don't have any deductible to meet for these type of expenses. Some of you may have a couple copays here and there throughout the year, and that's it. Pretty easy. Let's not forget that any preventive care is covered 100%. So that's your annual physical, well men and well women visits, immunizations, and mammograms and colonoscopies of age. Now, others of you may have a planned surgery or an outpatient lab test, or maybe you're having a baby, and that's when you'd be dipping into your deductible. The deductible refers to the total amount you as an employee have to pay out of pocket before the insurance company kicks in, and includes any inpatient or outpatient type of procedures. If you're an employee only on this plan, you have a $1,000 deductible to meet. After that, Blue Cross Blue Shield kicks in and will cover 80% of any remaining deductible qualifying expenses, meaning you only pay 20% of those expenses until your plan expenses reach $6,600, and this is your out-of-pocket maximum and refers to the most you could possibly pay on your plan before you max out. Keep in mind that along with the deductible you meet and any co-insurance you pay, your copays are also accumulating toward the out-of-pocket maximum and can help you max out quicker. Now let's say you cover your spouse and a few kids. You would still have the individual $1,000 deductible to meet, as would each of your family members. However, if two or more of you meet your individual deductibles, you would then hit your family deductible of $2,000, and coinsurance would kick in for any remaining family members, even if they didn't meet their individual deductible. The out-of-pocket maximum works in a similar way. If an individual meets the $6,600 individual out-of-pocket max, they would be covered 100% for the rest of the year. If two or more family members hit their individual out-of-pocket maximums, they had then met the family out-of-pocket maximum of $13,200, and the remainder of the family is covered 100% for the rest of the plan year. Now, you've heard me mention prescriptions a few times, so let's look at the cost breakdown for those. Blue Cross offers a 4-tiered drug plan where Tier 1 refers to your generic drugs, Tier 2 refers to your brand name drugs, Tier 3 represents those non-preferred brand name drugs and often injectable type drugs, and Tier 4 are generally your specialty drugs. Think the latest and the greatest on the market. These are often the drugs we see advertisements for on television. You can refer to Blue Cross's formulary to find where your prescription may fall, but you'll have just a set copay when you go to pick up your prescriptions. These copays accumulate to your out-of-pocket maximum, but not your deductible. You may notice the 90-day copays on this slide as well. Do you or a family member have any routine or maintenance prescriptions where you're picking up your drugs month after month after month? If so, we encourage you to sign up for the mail order program, where as long as the drug is available in a 90-day schedule, 3 months worth of the prescription will be mailed to your house. Not only do you get the perk of convenience by not having to go to the pharmacy each month, but the cost for drugs that fall on Tier 1 or 2 is only 2 months worth of copays instead of the full 3. So you'll find some great savings over the course of a year. That wraps up the discussion of the medical plan. I've attached the plan summary for your reference.
The idea of telemedicine is that members can access non-emergency medical assistance for all family members at any time and anywhere. The service is 24/7, 365, and you're able to consult a board-certified doctor via your phone, video, or the mobile app for more common ailments such as colds, rashes, pink eye, ear infection, etc. The way the service works is you initiate the consultation via one of the 3 methods, review the symptoms with the doctor, and the doctor can consult and send a prescription to your preferred pharmacy just like that. This service eliminates having to schedule a doctor's appointment, taking time off work to go to the appointment, and paying the doctor or urgent care copay. You can call at 3 a.m. from your house if your kid wakes up with an ear infection, or from your desk at work if you're feeling crummy throughout the day. The cost is $30, which is definitely less than what you would pay for urgent care services or at the ER. Keep in mind, you can only take advantage of this service if you're enrolled in the Blue Cross Blue Shield medical plan with FPL. We hope you consider using this new healthcare option. Now, before we move on, I want to educate you on some ways to save money on the medical plan. Don't forget, all your preventive care is covered 100% when you see an in-network doctor. We strongly encourage you to take advantage of these services to hopefully catch issues before they become a problem. In addition, for health emergencies that are less than life-threatening, think pink eye, poison ivy, the flu, allergies, or stomach issues, seek out urgent care facilities or utilize the telemedicine program we just discussed. You'll get in and out on a first-come, first-served basis, and the cost is significantly less than you'll find at an ER. Just another reminder, for those of you with maintenance prescriptions, sign up for the 90-day mail order program to save money on your drugs over the course of the year. Always ask your doctor if there's a generic alternative, as these drugs fall on the least expensive tier on Blue Cross's formulary. And finally, keep in mind that you can take advantage of public drug programs found at places like grocery stores, Walmart, Target. These prescriptions will not accumulate towards your Blue Cross out-of-pocket max since you're purchasing them outside of your plan, but oftentimes you can find huge savings. Walmart, for instance, has a big book of drugs that are just $2. Publix has about 10 antibiotics that are completely free. So do search around and take advantage of these public prescription programs.
Let's now move on to your dental plan, also offered by Blue Cross Blue Shield. When you sign up for this plan, all your preventive dental care is covered 100%. That services like your 2 routine cleanings a year, oral exams, and fluoride for your kids. Now, if you need anything else throughout the year, you do have a one-time $50 deductible payment to make, but we won't require more than 3 of your family members to meet that deductible. After that, your basic work is covered at 80%. This is things like fillings, cavities, simple extractions, and your major dental work will be covered at 50%. Major refers to more complicated procedures like dentures, bridges, and crowns. Now, each covered member will have up to $1,500 paid out towards their dental services each year. So in the event your expenses exceed that annual maximum, you'll be paying out of pocket for the remainder of the year. Next in the pipeline is your vision coverage, also offered through Blue Cross Blue Shield. The idea of vision coverage is that if you enroll, you have just a $10 copay, which gets you your annual eye exam once per calendar year. Then each year, you have one of 2 options. You can either choose contacts, in which case you'll get an allowance of $130 towards your prescription. And this allowance is available once every calendar year. Or you can choose glasses. If you choose glasses, you have a $25 copay, which gets you an allowance of $150 towards the actual hardware. Now you'll get the frames allowance once every 2 calendar years, but you can switch out the lenses in your frames each year for just a $25 copay. You can learn how to search for a vision provider and find some additional information in the attached document. Let's now review your life and disability plans, all offered by OneAmerica. We'll start off with your employer-paid Basic Life program.
As a full-time employee of FPL Foods, you're automatically enrolled in a Basic Life and AD&D benefit of $10,000. This is paid for you by your employer and serves as a financial protection for your loved ones in the event of a premature death. You'll provide your beneficiary information when you enroll. This is the person or persons who will receive the benefit should anything happen to you. Be sure to keep this information up to date throughout the year, as families do change from time to time, and we want to ensure the most appropriate person or persons are set up.
In the event you're interested in additional life insurance on top of what your employer provides, or if you're wanting to sign up your spouse or children with life insurance, you'll want to consider the Voluntary Life program offered by FPL. Employees can enroll in increments of $1,000 up to 5 times your salary, but no more than $500,000. You may enroll your spouse in increments of $500, not to exceed your coverage amount. Keep in mind, the benefit minimum for yourself and your spouse is $10,000 each. You may also enroll your children in increments of $2,500 up to $10,000. Please be aware you may only enroll your dependents if you enroll in employee coverage. As a new hire or newly eligible employee, you have a unique opportunity to elect up to the guarantee issue amounts of insurance with no medical questions whatsoever. It's guaranteed. The guarantee issue for you is $150,000. For your spouse, it's $30,000, and for eligible children, it's $10,000. If you choose to waive coverage during new hire enrollment and enroll at a later date, or if you'd like to increase your coverage amount at a later date, you're subject to the medical questionnaire called an EOI to be approved. Now let's look into your disability plans in a little more detail. FPL also offers both a short-term and long-term disability program. Let's look at short-term first. This is more or less a paycheck protection program because in the event you go out of work due to an accident or illness, on the 15th day you're out of the office, should you meet the definition of disability, you'll start to receive weekly benefit checks in the place of your paycheck. If you're not at work, you're not getting paid. So these benefit checks help fill in the void. There are 2 coverage options for short-term disability. The first offers 40% of your paycheck up to $1,650 per week. And the second option offers 60% of your weekly paycheck with the same limit. If you continue to be out of the office, you can continue to receive these checks for up to 11 weeks. Now let's say those 11 weeks pass and you're still out of the office. If you also enroll in long-term disability, you would automatically transition right into this benefit. Those weekly benefit checks would turn into monthly benefit checks, and you continue to receive these benefits for 5 years or Social Security full retirement age. This is a chunk of income that's protected by this plan. There are also 2 coverage options for LTD. One for 40% coverage of your monthly earnings, and the second covers 60% of your earnings, both up to $3,000 per month. You can find benefit summaries for both short-term and long-term disability attached here. Let's briefly look at the Employee Assistance Program offered by OneAmerica. Yet another benefit provided to you by your employer is your Employee Assistance Program, otherwise known as EAP. This is a complimentary, confidential counseling service offering assistance for you and your family members for a variety of personal issues. So SPL will never know if you call, or certainly what you call about. This program includes unlimited calls all year, and in the event you may benefit from seeing a specialist in person, the plan includes 3 face-to-face sessions per family member as well. The contact information for your EAP is included in your benefit brochure, so please keep that handy throughout the year for any of your personal needs. Let's next review the Colonial voluntary benefits offered to you this upcoming year.
The idea of accident and critical illness coverage is that even with a major medical plan, you still have expenses, whether it be in the form of copays, deductibles, etc. These products pay a lump sum benefit that you can use however you'd like and help fill in those voids. If you enroll in either or both of these plans, you automatically have access to 2 other benefits offered through Colonial. First up, you're also able to participate in the WellCard prescription discount program, which could save you and your family money on doctor's visits, prescription drugs, lab work, and x-rays. Lastly, you also have the option to participate in a financial wellness program, which offers answers to your questions about personal finance, budgets, savings, debt, and includes financial coaching, online tools, and webinars as well.
Last but not least, let's take a quick look at your 401k retirement program. SPL Food offers a 401k retirement plan to all eligible employees. So as long as you've been employed full-time for 3 months and are at least 21 years of age, you're allowed to participate in the program. Upon meeting eligibility, you'll be automatically enrolled in the plan with 1% of your earnings going into your account. After each year of your service with SPL, this contribution will automatically increase 1% each year until you reach 3 years of service, at which point the automatic contribution increase will cap out at 3%. If you'd like to change or increase your deferral amount, you may log in to the ADP 401k website at any time to do so. SPL may also choose to match a portion of your contributions, but this will be based on business conditions and is therefore not a guaranteed benefit. If you're still following along, you've made it to the end. Let's review the next important steps in your enrollment process. First and foremost, be sure to enroll on the ADP portal. Secondly, be mindful of the different places we need to know your beneficiaries. This is for your basic life and voluntary coverages, as well as for your 401k. Need any assistance during open enrollment? Don't forget that Jackie Burns and Nicole Travis from my office are readily available to help.